Hello, I'm Dr. Mark Leeds, and I work in the field of what they call now deprescribing, which is an interesting field. Deprescribing is also called tapering. Tapering or deprescribing is the practice of reducing a medication or a drug that someone's taking to help them get off of it, but at a safe rate. And usually, these days, when people talk about deprescribing or tapering, they're talking about psychiatric medications, benzodiazepines, antidepressants, antipsychotics, medications like gabapentin, Lyrica, which they call gabapentinoids now. Um, anyway, so these are what people think about. Benzodiazepines are a big one. That's a big topic in the world of deprescribing, tapering, and there's two authoritative books on the topic. The original is the Ashton Manual, which was written by Dr. Heather Ashton in England, and she studied people for decades and helped them to come off of benzodiazepines, things like Ativan, alprazolam, which is Xanax, or clonazepam, Klonopin, and her method was to switch them over to Valium, which is a weaker, much longer acting medication, and so that was like a tapering mechanism that she used, and so the newer book, the Maudsley Deprescribing Guide, covers more medications. It covers like the categories I talked about before, the benzos and the antidepressants, antipsychotics, and gabapentin and Lyrica, and it describes how a person should taper, at what rate, how fast should they taper, and they describe the hyperbolic curve, which is a reduction at a curve that starts out somewhat steep and then levels out, and so a person would be able to, under the supervision of their doctor, cut their medication faster in the beginning, and then they would slow down as they got to lower and lower amounts. Technically, the way they describe it, usually it's by percentages, where it might be 5%, 10%, maybe even as low as 2 to 2.5%, maybe as high as 15% at the highest. Technically, that would be an exponential decay curve, but it approximates a hyperbolic curve. They're pretty close. So but the idea is that you can go faster in the beginning, and following that percentage rate, you'll slow down as you go, and they recommend in many cases to use a liquid preparation. So for example, if you're using clonazepam or alprazolam, Xanax is actually not a really good medication to taper on. Ideally, should be switched to a longer acting medication because it's really short acting. But you can get liquid preparations made by a compound pharmacy, and they talk about other methods people can use if their doctor is just giving them the medication, but not really helping them with a taper. So there's some other ways that they talk about it in that book. I like the Ashton Manual. I think Dr. Ashton was really onto something with the conversion to diazepam. Now, do people deprescribe or taper with other drugs or medication? What about things like the opioids, alcohol, drugs that are considered to be more of addictive drugs, where the benzodiazepines tend not to be addicting. They cause physical dependence, which is why you need to do the tapering, coming off gradually. But what about alcohol, for example? Can you taper off of alcohol? Well, first thought would be, how can you taper off of alcohol? Because alcohol is an addicting drug. Someone who has a problem using too much alcohol, if you tell them, okay, you drink 10 beers a day, let's try 9 beers next week every day, let's try 8 the week after, most people who have an alcohol addiction or, an alcohol problem won't be able to stick to that. But there is a way to taper off of alcohol. Usually the treatment for alcohol is a fast detox. Um, they go cold turkey, they quit the alcohol, they go into a very distressed um, situation, which can be life-threatening. They can have dangerous seizures or other conditions where they can, it's very dangerous to just stop drinking if you're drinking a lot every day and there's no medical supervision. So they use a variety of medical treatments, including benzodiazepines, actually short-term, to get the person safely off of alcohol, going cold turkey. And what tends to happen in a lot of cases is down the road, several months later, the person who came off of alcohol will tend to have some pretty bad cravings for alcohol. They'll start thinking about it. They may do great in the beginning. They leave the detox program and they graduate from that and they feel great. But a few months down the road, they start really thinking about alcohol and wanting just to have that one more drink. And they call that the alcohol deprivation syndrome. And one way around that, and for a lot of people is considered to be a safer way to quit drinking, is to quit gradually. And the way that people can taper is by something called the Sinclair method, also called pharmacological extinction, where they take naltrexone, an opioid blocker, while they drink. Or actually, you take one tablet, a 50 milligram tablet, an hour before you have a drink. And over time, and with that, each of those drinks, the compulsion to keep drinking is reduced. And the interest in alcohol naturally reduces over time. And it's based on the model of Pavlov's dogs, the idea of that person is conditioned to drink and they have an endorphin release in the brain, stimulating opioid receptors in the brain, and that's kind of the reward for drinking. And if you block that, even though a person can still get intoxicated, it's just not as pleasant as it was before, and they'll tend to not want to drink as much just naturally without even thinking about it. If they graph their drinking over time, they'll drink less. And so that's a way to taper off of alcohol. So it actually, it's not just for the psychiatric medications and prescribed medications, but a person can actually taper off of alcohol. And what about opioids? What about things like heroin, fentanyl, prescribed opioids like oxycodone, morphine, Dilaudid? It's possible to taper from opioids also, and the way they do that is with medication-assisted treatment. Most commonly now is with buprenorphine, the medication in Suboxone, and it doesn't have, some people take it indefinitely, but it doesn't have to be that way. Usually it's recommended to take it for at least a year. And during that year, the person can take less and less. In fact, a lot of times patients find on their own that they don't need as much. They might start at 16 milligrams, and little by little they find they only need 14, and 12, 10. The doctor will supervise this taper, but the patients are usually very willing to reduce the medication, and it's kind of similar as far as it gets harder as you get lower down. Going from 16 to 8 is not too bad. Going from 8 to 4 milligrams is harder. Going from 4 down, it gets much harder, significantly more difficult, more withdrawal type symptoms as a person tries to reduce. And the hardest is usually from 2 milligrams down. So the curve, the reduction curve, is very likely, if you were to study that, would probably follow a similar hyperbolic or exponential decay curve. So you can taper off of opioids, which is interesting. Now, are there other drugs where tapering is impractical? Well, wherever there's no, when you have medication-assisted treatment, for example, like we talked about alcohol, you have naltrexone. Opioids, you have buprenorphine. They also have methadone as another option. And with benzodiazepines, you have Valium, which kind of, in a way, there's some parallels between how Suboxone or buprenorphine works and how Valium helps with the benzo tapering. They're both for example, buprenorphine is a weak opioid. It's a partial agonist, and so it's weak and it's very long acting. And Valium is also for benzos is weak and long acting. And so it's different, but it's tapering. It tends to be the best way to get off of something that, medications or drugs that cross into the blood-brain barrier and affect the central nervous system, and cause physical dependence in the brain. Tapering is usually the best approach. So anyway, yeah, thank you for watching, listening, and that's kind of a few minutes description of what a deprescribing doctor does. They help supervise those medical tapers, gradually reducing a drug or medication.